Hi, everybody. Sorry about that. We have a big crowd of speakers today. We have lots of different announcements and recognitions that we want to do here, so thank you very much. I want to first just take a moment to reflect on the life of Hank Aaron. It just came out that he passed away, and you know, I was on a text chain with a bunch of mayors around America, and they were talking about doing moments of silence. So not to kind of get ahead of my colleagues, but let's just take a moment of silence for Hank Aaron, baseball great. Thank you. Today I'm going to discuss COVID-19 and some city updates. Then we're going to hear from Dr. Thea James of Boston Medical Center, who's also a member of the COVID-19 Health Inequities Task Force, as well as Deputy Superintendent Janelle Jimenez from Boston EMS. They're going to talk about their experience with COVID vaccine in the communities that they serve. And then Chief Marty Martinez, Health and Human Services, will speak about COVID-19. And at the end of the press conference, all of the speakers today will be available for questions. Marty Martinez will be handling all of the COVID questions for us. Before I get into the COVID updates, I want to make an announcement about an exciting opportunity here in the city of Boston. Today I'm joined by Tommy Lyons, a Vietnam Marine veteran and the chairman of the Boston Congressional Medal of Honor Society, the host committee, and Tom Kelly, a recipient of the Medal of Honor recipient, and Boston's Commissioner of Veterans Affairs, Rob Santiago. Together, we're proud to announce that the Congressional Medal of Honor Society is planning to host its annual convention and Patriot Award dinner in Boston later this year. This will be the fourth time that this honor is in our city of Boston. It means Boston has hosted this event more than any other city in America. It's a great honor for our city to host our bravest and most valiant heroes. We hope that they'll be able to host a smaller scale convention this fall, if and when the public health data tells us it's safe. We're going to provide more details and information as we get closer, but I'd like to bring up Tom Kelly, Medal of Honor recipient, American hero, to the podium to talk a little more about the convention.
Thank you, Mr. Mayor. Yeah, as the mayor mentioned, we'll be back here in Boston for the fourth time in September for our Congressional Medal of Honor Society annual convention. We currently have 69 living recipients of the Medal of Honor. I expect about 40 of them will probably come with their families. Among the things that we'll be doing during the convention, health considerations permitting, we'll be going out to visit schools, talking to the kids. Last time in 2016, I think we visited 13 schools in the area, and we arrived by helicopter at about 7 of those schools and landed right on the football fields and things with Black Hawk helicopters provided by the Mass National Guard. So we're delighted to be coming back. As soon as people heard we're coming to Boston, their ears went up, and they never have a bad time here. And Boston's been terrific to us, and we just like to thank everybody for their hospitality in advance, and look forward to September. Thank you.
If anyone has any questions for Tom or Tommy Lyons or Commissioner Santiago, please ask at this point.
Thank you.
Well, I can tell you, I was here a couple of years ago. We had the Medal of Honor convention in Boston, and outside my office, down a little outside my office, there's a picture of all the Medal of Honor recipients. And anytime somebody comes into the office, particularly young people, I tell them that everyone on this wall is a movie, everyone on this wall is a book, everyone on this wall is a true American hero for the sacrifices they've made for all of us, for our freedoms, for democracy. And it's such, when I say it's exciting, it's a humbling experience for us in the city of Boston to host this convention. And I just encourage everyone, if you have a chance to, if there's a public event, and we'll know a little later in the year how we're doing with the vaccine and how we're doing with immunity. But it's such an amazing experience. These men and women are everyday Americans. they've come back and they've gone to work in different capacities, and they truly are American heroes, and it's something that we need to continue to respect and appreciate their sacrifice and their family sacrifice to our country. So, Tom, thank you. I know Tom Kelly, thank you for your persistence in this and the work you've done, and you and Tommy Lyons and Commissioner Santiago. It's such a great honor for the city of Boston and for all the veterans in our city. We have amazing veterans in our city of all the armed services, so thank you very much for that. To transition to the latest COVID-19 numbers, the state numbers, 4,821 new confirmed cases as of yesterday. 75 new deaths were reported as of yesterday, bringing the death total in the Commonwealth of Massachusetts to 13,622. In Boston, as of yesterday, we don't have today's numbers yet, 461 new confirmed cases, bringing the total of cases to 49,840, which means that when today's numbers come in, we'll probably be over the 50,000 mark in the city of Boston. We had 6 people, deaths were reported yesterday, bringing our death total to 1,113 people who have lost their life. Our prayers go out to the families of who lost loved ones, and also praying for the people that are still, the families and the individuals that are sick and suffering still with coronavirus that are in our hospitals. We want you to know we're thinking of you and praying for you. Our latest data for the week ending January 14th, an average of 5,594 people were tested. That's down slightly compared to the week before, and as always, it does not include college testing. The average number of positive tests each day last week was 447.9. That's down from the week before, 544.3. Our current positivity rate in the city of Boston is 7.5% for this past week. That's lower than the week before at 8.7%, so we're seeing at least a good number heading that way. We've seen the positive rates go down in almost every single neighborhood as well, which is encouraging to see. We're seeing improvements in our numbers as they stabilize, but we know that this can change at any time. Right now, our case numbers are still concerning, and our hospital numbers are certainly higher than we'd like them to be. Our COVID hospital admissions are slightly down from the previous week, but the percentage of our adult non-surge ICU beds occupied remains high at 99%, and Marty Martinez can get a little more into that in a little bit. Hospitals can add surge beds if necessary, and if they go beyond the 100% of normal usage. So we are keeping a very close eye on that to see where we are with that. And again, Marty will talk a little more about that when he comes up here. But again, this is the highest we've seen in a long time when it comes to hospital capacity. So we're in constant contact with our hospitals to support them and help them preserve their capacity. We want to continue to monitor to make sure that our hospitals have the capacity to take care of everyone that needs them. This weekend, the first case of the new COVID variant was detected in Boston resident who traveled internationally. We recently learned of another Massachusetts resident who tested positive for this variant. The Boston Public Health Commission's Infectious Disease Bureau is working closely with our partners at the State Department of Public Health to monitor the situation and keep a close eye on this new strand. The health and well-being of our residents certainly remains our top priority, and here's what we need to know about this new COVID variant. There is no evidence that it causes more severe illness or increased risk of death. However, it can spread more easily and quickly than the other variants. A high transmission rate will lead to more cases and could potentially burden our healthcare system, so we're keeping a very close eye and monitoring that so that we can keep those numbers down. That means we all need to continue to double down on the precautions we're taking to slow the spread of the virus. Our success depends on the actions we all take every single day to protect our communities and help save lives. That includes continuing to wear a mask when you're outside your home, keeping at least 6 feet distance from yourself and someone else, which is very important. Avoid large gatherings, wash hands often with soap and warm water, and continue to get tested as much as possible. If we can, our testing locations, I'm going to talk about in a second, are open, so it's important to, where you have to schedule those appointments, schedule them, and some you can just show up. We have 30 testing sites throughout the city. We also have mobile sites which are free open to all, regardless of symptoms. This week, our testing sites, our mobile sites, one is in Hyde Park at the Boston Renaissance Charter School. It's drive-through only, appointment required. The results come back really quick. In Roxbury at Washington Park Mall, this is a walk-up site and registration is required. In Grove Hall at the Prince Hall Grand Lodge, this is a walk-up site with on-site registration. in Jamaica Plain at the Anna Cole Community Center. This is a walk-up site and no appointment or registration is required. Those places that don't have registration required, you might have a little bit of a wait, but the lines do move pretty quickly. I have not heard any complaints about being out in lines for hours and hours and hours, so we want to be able to get you in and out as quickly as possible. Dates and times vary, so we're asking you to visit boston.gov or call 311 for complete details. We can get you a full list of hours of operation and when they're open and how to use them. Yesterday, the state made some adjustments to the statewide reopening plan. They're lifting the stay-at-home order for the hours between 10 p.m. and 5 a.m. effective this coming Monday, January 25th. Also effective Monday is the lifting of the early closure order, which requires certain businesses to close by 9:30. The state is also extending the temporary limit on capacity and gatherings, currently at 25%, until February 8th. So that is staying in place till February 8th. So only 25% capacity in all different public-facing businesses and museums and things like that. In the state, Boston's a little different right now. The state is lifting of early closing times will apply to businesses in Boston, so that means Monday. Restaurants will be able to stay open later, and businesses that are currently open will be able to stay open later. However, the list allowed an in-person activity in Boston will continue to be subject to the City of Boston's temporary rollback of Phase 2. As a reminder, we extended the rollback to at least January 27th. For a full list of activities and businesses allowed to modify Phase 2, Step 2, we're asking people to go to boston.gov. This rollback was an effort to slow the spread of the virus, protect our hospital capacity here in Boston, and avoid more severe shutdown later on. We are taking a cautious approach, doing what is right for Boston. We're going to continue to evaluate the situation in our city and provide an update on whether this pause will continue or end next week. So we will have more information on that phasing next week for everybody. So as of right now, we are at Phase 2, Step 2 in the City of Boston. As I mentioned, the numbers can change any time. The last thing we want to do is reopen too quickly, because in the effort we might have to close down again. And we must continue to protect our hospital capacity, especially when the threat of this new COVID variant. As far as vaccine distributions, we'll continue to work with the state on an equitable vaccine distribution plan. The full schedule of vaccine distributions can be found at mass.gov. Earlier this week, the state announced a new vaccine partnership with CVS and Walgreens pharmacies, as well as expanded vaccine location sites. Fenway Park will open as a second mass vaccination site, on February 1st. They plan to start administering up to 500 vaccines per day to eligible residents in the Phase 1 priority group. Yesterday, the Boston Public Health Commission held a virtual COVID-19 vaccine information session to address concerns and questions about the vaccine. We will post all of the recordings online in the next few days. Next week, on January 28th, this session will be held in Spanish. You can tune in at bphc.org. We urge everyone to get vaccine when it's your turn. It's safe, and it's one of the best things you can do to protect your family and community and yourself. We understand that some people are hesitant to take the vaccine. This is especially true in the Black and Latino communities. There is no doubt that throughout history, communities of color have faced discrimination in the outright cruelty in the healthcare system. This is a tragic outcome for systemic racism in our country. This has been a focus of our Health and Equities Task Force. We're talking to residents about their concerns, and what we're doing is working to build trust in those communities. COVID-19 has hit communities of color the hardest. The numbers don't lie, the numbers say it. The economic fallout has hit communities of color the hardest as well. Again, the numbers don't lie. We don't want communities of color to miss out on the vaccine, because it's the best tool we have to put this pandemic behind us and begin to heal our city and our state and our country. The City of Boston will continue to empower local residents to share information in their communities and in their languages, and to make sure everyone has the facts about vaccines. Today, you're going to hear from two healthcare professionals and leaders in our city, Dr. Thea James of Boston Medical Center and EMS Deputy Superintendent Janelle Jimenez. They will talk about their experiences with the vaccine. Again, I urge everyone to get it when it's your time, when your time comes. I thank everyone who's taken it already. So I'm going to ask Dr. James to come up, and then I'm going to ask Janelle to come up, and then Chief Marty Martinez will take questions on coronavirus. So with that, Dr. James.
Good morning. Thank you, Mayor Walsh and Chief Martinez. We value your partnership with the city's healthcare organizations during this pandemic, and it's a privilege to be here this morning. As an emergency medicine physician at Boston Medical Center, I have seen firsthand the hurt this pandemic has caused to our entire region, and particularly in Black and brown communities. I also know that many people are hesitant to take the COVID vaccine, again, especially in Black and brown communities. And there are valid reasons why you might feel this way. Some are historic, and some might be more recent. For example, having a bad experience with the healthcare system. Or maybe you have questions and concerns and you need more information. Well, I'm here today because I understand how you feel, 100%. Because I live in the world like you do. I'm also here because I was hesitant. And, you know, I was where you might be right now. I was struggling. I was really struggling. And I was struggling because of the pandemic, there were rollbacks and there were restrictions. And that means that many people cannot work like they used to. Many people cannot earn a living the way they used to. Many people can't take care of their families the way they used to. They can't feed their families the way they used to. And as we've all seen in some of the worst case scenarios, many families have been devastated and disrupted by severe illness as well as death. And I'm a physician. You know, I knew the science. That part was clear. I knew that there are strict protocols to developing a vaccine. I knew that because of the pandemic, the vaccine was produced quickly, but I also knew that it went through the same vigorous scientific review as other vaccines. I also knew that the data shows that the vaccine is 95% effective. And I'm aware that there are misconceptions, out there. So I also knew that there was no live virus in the vaccine, and I knew that it also didn't change your DNA. And I also know how the vaccine works by telling your body to make antibodies against the COVID-19 virus. But with all that knowledge and information, I was still struggling. And then one day, I said it out loud. People heard me. And for the next 2 days, it was all I could think about. I just couldn't get it out of my head. And then finally, over those next 2 days, I just came to the conclusion that, the fastest way back to thriving for us is the vaccine. And I decided that although I was feeling helpless and struggling, the one thing I could do is I could take the vaccine. And honestly, after the first shot, I felt 100% better. It was just a sense of relief, a burden that I could be a part of, helping us get back to a sense of normalcy where people are thriving and being able to take care of their families. And I've since had the second shot, and nothing happened. I'm still here. The only thing I had was a sore arm after the first shot. So from my perspective, the vaccine is our way out of this pandemic. But until we're there, until you're there, please remain to be safe. Please still wash your hands, wear a mask, do social distancing, avoid crowds. You know the drill. You know it already. And if for any reason you need medical attention, for any reason, please know that our hospitals are safe for medical care and ready to help you. So thank you so much, and thank you for allowing me to share my own personal journey with you. Thank you.
Good morning. I'm Deputy Superintendent Janelle Jimenez, as said before. I have been with Boston EMS for the last 15 years. During this pandemic, I have been going to work every day as a paramedic, and as of now, as a deputy. I've been coming home as a mother, daughter, and sister, knowing deep down inside that no matter how much protective equipment I wear or appropriate precautions are taken while at work, there was still a chance that I could bring this deadly virus home to my loved ones. Without a doubt, this past year has been a difficult one for everyone at Boston EMS. Work in the front lines, both answering the calls at dispatch and in the field. Doing call after call in full personal protective equipment is physically and emotionally exhausting. We are tired, but we are proud. Proud to be on the front lines during this pandemic. I want to commend every single one of our EMTs and paramedics. I am really proud of how our members have handled this. As soon as I was given the opportunity to get vaccinated, I took it. I am very thankful to have been given the opportunity to be one of the Phase 1 recipients. I got the vaccine for my family, my friends, and for the community that I serve. Please continue to follow public health guidelines, wear a mask, wash your hands, and maintain social distancing. As soon as the vaccine becomes available to you, take advantage of this opportunity. The vaccine is safe, and it is the only way to get past the pandemic. If we want to one day go back to where we were, we need to all do our part. Thank you. I'll be doing a bit in Spanish. Ha estado con Boston EMS durante los últimos 15 años. Durante esta pandemia he estado trabajando como paramédica y ahora como superintendente adjunta, y volviendo a la casa como madre, hija y hermana, sabiendo en el fondo que no importa cuánto equipo de protección use o precauciones adecuadas se tomen en el trabajo, todavía existe la posibilidad de que pueda llevar este virus mortal a la casa con mis seres queridos. Sin dudas, este año y el año pasado ha sido el más difícil para todos en Boston EMS. Trabajando en la primera línea de esta pandemia, respondiendo a las llamadas. Hacer una llamada tras otra con el equipo de protección personal completo es física y emocionalmente agotador. Estamos cansados, pero estamos orgullosos. Orgullosos de estar en la primera línea durante esta pandemia. Quiero reconocer el esfuerzo de nuestros técnicos de emergencia médicas y paramédicos. Estoy muy orgullosa de cómo nuestros miembros han manejado esto. Tan pronto como tuve la oportunidad, me vacuné. Estoy muy agradecida de haber tenido la oportunidad de ser una de las beneficiarias de la fase 1. Me vacuné por mi familia y mis amigos y por la comunidad a la que sirvo. Continúe siguiendo las pautas de salud pública. Use la máscara, lave las manos y mantenga el distanciamiento social. Y tan pronto como la vacuna esté disponible, aproveche la oportunidad. La vacuna es segura y es la única forma de superar esta pandemia. Si queremos volver a ser como éramos un día, tenemos que hacer nuestra parte. Gracias.
So again, I'm Marty Martinez, the Chief of Health and Human Services. Before I open up for any COVID questions, just want to both thank Dr. James and Deputy Jimenez. Obviously all the work that the state is doing to create, vaccination access, and all the work we're doing as the city to ensure that folks can get vaccinated, whether it's our first responders, home health workers, whether it's school nurses, everyone in this first phase as we keep going. What you heard from Deputy Jimenez and Dr. James is really an acknowledgement of understanding why it's so important to get vaccinated. And so we want to continue to reinforce that message in the community, that when you're able, when you are on the list, on the priority list, we really want you to get vaccinated. We want people to take advantage of it because both of them sort of said this very eloquently. It is our way out of COVID. It is our way to build safety for ourselves and our families. And so again, thank you to both Dr. James and Deputy Jimenez for sharing your story and helping people understand why it's important to get vaccinated. The only other piece I'll share with you on the city end, we continue to partner with the state to focus on additional additional vaccination sites. We are focused on that. We shared with you last week that we are working to be able to lift up the Reggie Lewis Center. We continue along that path to be able to do that, and we are continuing to vaccinate our first responders. I think there's been roughly 2,300 first responders have been vaccinated in the city. And we hope to be able to vaccinate continuously here and into next week in partnership with Tufts Medical Center and BMC. And we're continuing to work through lifting up additional sites so we can vaccinate folks along the phases. So we're eager to continue that work and to respond to what we're seeing with COVID in our metrics and everything that everyone continues to do. So with that, if you have COVID questions, I'm glad to take them, or Dr. James or Superintendent Jimenez. Yeah, so the question is what is the city doing to make sure we can get vaccines to diverse communities and to get it to folks, and working with the state to do that? Yeah, I mean, we're both not only ensuring that sites that get lifted up are lifted up in diverse neighborhoods, which is a really important piece, but it's also why we have a four-prong approach. The mass vaccination sites are super important so that a lot of people can get vaccinated, but it's also why we're working on community-based sites in partnership with community-based organizations so that when folks qualify and you're in a diverse neighborhood, you can go somewhere in your neighborhood to get vaccinated. So that's an important piece of it. We also have launched a public awareness campaign specifically in communities of color. That's why we had one webinar yesterday. We have one in Spanish coming up and additional languages moving forward, so that we can also support direct engagement to make sure people understand the story. And we're also, again, partnering with community-based organizations. We opened up through the Boston Resiliency Fund some resources for nonprofit organizations to apply to create messaging into the community, specifically around vaccine awareness and education. So again, I mean, we're partnering with the state to do all this work and following their guidance and leadership. I think it's really important. Sometimes you'll see in other states it's sort of a free-for-all where anyone can go if you can get it. That's oftentimes when you do that, those who need it the most still don't get it. So it's really, really important that we do the best we can to prioritize those through the state process, and we're working with them to do exactly that. Yeah, so sorry. So if you have any COVID questions, I can answer them for you. So I can't, I don't have any information to give you about the mayor. Yeah. Yes, a great question. The question is that hospitals are starting to vaccinate folks, all employees, and some note the question about whether or not even folks that are working from home or not working in person. The state opened up that guidance for hospitals so that hospitals could vaccinate employees. Right? It's really important in our healthcare settings. People are coming and going, and we really need folks in our healthcare settings to be able to take care of those who need it without any fear of exposure or spreading it to others. I can't tell you whether all Boston hospitals are doing that, but prioritizing getting people vaccinated is the goal. We want to stay in that prioritization and do that, but again, that's controlled by the state. So the state opened that up, and hospitals are trying to vaccinate folks. Yeah, so the question is, do we think it's fair? I mean, there are many, in terms of making sure diverse communities are hit, there are many folks of color working in those hospitals, in many jobs across the board, Boston residents working both frontline staff and working in food service and doctors and nurses, et cetera. So we want people to get vaccinated, and we want it to be accessible. And so I think whether we think it's fair or not, I think the reality is the more people getting it, the more people that get access, the better for the city.
Vaccine or spoiled at the VA. So Mayor has any reaction to that?
So the question is about the VA and the 1,900 doses. That's all coordinated through the state. So the city learned about that also today. So we have no specific reaction to it. That's a direct connection between that facility and the state. So we don't have any specific reaction to it.
Doses and treat them. That was an honest mistake. It sounds like the contractor, but you're urging people to get vaccinated, and an honest mistake was set it back in 19 doses.
Yeah, I mean, It's a great point. It's an honest mistake, but again, is that difficult? No question. I mean, not only do we want more doses from the federal government, we want more doses coming into the state, we want more doses getting into the city, and we want those that are administering those doses to be able to take the care needed so that doesn't happen. So there's no question about that. The reality is that we want to make sure that there's doses for people to take and for people to be able to utilize. But those things happen. I mean, sometimes freezer's temperature isn't what you want it to be. Sometimes someone opens a vial without having a plan for the rest of the doses. So sometimes that can happen. But again, generally, we need everyone to take care, especially those clinical providers, and the ones we're working with want to avoid any kind of situation like that.
Both the hospital capacity and the amount of vaccines coming in supply, how are both of those?
So the question is, can we talk a little bit about hospital capacity and then vaccine supply? The hospital capacity is tight, as Mayor Walsh mentioned. It's clear that hospitals are tight on beds and tight on capacity. One of the things that I think is different than where we were in the spring when we had some tight capacity, the overwhelming majority of patients and the increase in patients over the last couple weeks really has been non-COVID patients. We right now have around 380 COVID positive patients in our Boston hospitals, down from maybe 450, 460 about 10 days ago. So we definitely have seen the COVID numbers improve, which is a good thing. And we've seen more patients non-COVID in our Boston hospitals, which has tightened the capacity. But again, that's what we don't want anyone to have to be in the hospital, but we want people to get taken care of if they need to. And our hospitals have done an amazing job at being able to balance that out and ensure that there's beds for people who need it, and they continue to do that, and we're continuing to partner with them. On the vaccine, obviously the state is working with the federal government to loosen that up, and I think the challenge is continuing to make sure that vaccines flow into the state and then flow into the city. The state did notify us through the city that the doses hopefully will be increased over the next couple weeks so that we see greater access to doses here. It's important to remember we not only want the first doses, but we need to make sure that providers have the second dose so that folks can get vaccinated. But I feel confident that the federal government and the new administration is going to be able to meet that growing demand.
You talked about the balance between states and announcing those restrictions yesterday and then step 2, phase 2 here in Boston, and kind of the back and forth in terms of why you guys decided to do what you did.
Yeah, so the question is talk a little bit about the state's restrictions and their pullback, and then where we are and how that balance takes place. For us, it's a huge balance, right? I mean, the state loosened restrictions, and we support and partner with them in terms of what they try to do in loosening that 9:30 restriction. We have restrictions, and as we have been the entire time, the city of Boston has always been what's best for the city of Boston, which is why we're at phase 2, step 2, and still have restrictions in place. And we're going to look at new data. We have another data report coming out tomorrow morning. Will show us a little bit more about the trends to see if we can loosen any of the restrictions that we have in place. But I'm the health and human service guy, so for me, it's about how do we open slowly and not quickly, and how do we make sure that we don't have to go back and restrict again because we open too quickly. I think the variant is still part of this equation. We don't know if we've seen the effect of that yet. And so it's important to know that if we see increased cases and a greater capacity pull on our hospitals, we then will end up seeing more cases and be concerned about the spread. So it's all a balance, but we've worked very collaboratively with the state, and we'll continue to do so. No, it's just why there's more non-COVID patients in the hospital. I mean, again, it's just about the hospitals being able to take care of folks, right? So it's a variety of different things, right, that people go into the hospital for, and it's clear in the ICU and regular medical surgical beds, it's not beyond normal. It's normal sort of, people coming in. But again, the whole balance with COVID's always been about, can you take care of everyone's needs and the COVID pandemic at the same time? And our hospitals are absolutely doing that. Thank you so much, everyone. Appreciate it.